Good morning, everyone. Honorable Dr. Frank Anthony, Minister of Health, Guyana, Dr. Armstrong Alexis, Deputy Secretary General, CARICOM, Her Excellency Ambassador Jane Miller, British High Commissioner to Guyana and Ambassador to CARICOM, Ms. Elizabeth Solomon, Assistant Secretary General, Foreign and Community Relations, Dr. Juan Manuel Sotelo, Interim Director for the Pan American Health Organization's Caribbean Subregional Program Coordination Office, Ms. Piedad Huerta Anaros, Head of the Country and Subregional Coordination Office. I usually just call her Piedad, so stumbled on her name. Mr. Daniel Albrecht, PWR Ad Interim Guyana Office, PAHO WHO Directors, PAHO WHO Representatives, Dr. Lisa Indar, Ad Interim Executive Director, Caribbean Public Health Agency, Ms. Elizabeth Riley, Executive Director of the Caribbean Disaster and Emergency Management Agency, Mr. Adam Lawyer, Counselor Development, Canadian High Commission, Mr. Aaron Spencer, Senior Development Advisor for USAID, Ms. Micah Arts, UNICEF Regional Office for Latin America and the Caribbean, representatives of member states and regional institutions, other international development partners, CARICOM Secretariat, Ministry of Health, and PAHO colleagues, members of the press, both in the room and joining us virtually, those of you following us on social media, good morning. We have quite a group of esteemed colleagues gathered. So my name is Lisa Bailey, and I'll be your Master of Ceremonies for this short opening ceremony, and I am Specialist Communications for Health Promotion for the PAHO Caribbean Subregional Office. Welcome to this multisectoral and stakeholder consultation here at the hallowed halls of the CARICOM Secretariat. We are going to start with our safety and protocol briefing, and that will be done by Ian Cole from CARICOM.
you. Good morning, everyone. My task is very simple this morning, ladies and gentlemen. First of all, our Wi-Fi access. Everyone in the room can access the Wi-Fi with the password CARICOM123 and 3 stars. For those of us who are using microphones around the conference table, please note that if you press the silver button on the right, the mic will be activated. A red light usually comes on the microphone when it's on, and that's how you will know that your microphone is activated. It is advised that not more than one person speaks. A wireless microphone will be available for persons who are seated in rows behind the table at the back. For those of you who need to use the washrooms during the meeting sessions, please note that the washrooms are located down the corridor going east. Turn right, there's 2 doors, one on the right, one on the left. The one on the right is the male washroom, the one on the left is the female washroom. For emergency exits, in the event of an emergency, this room has an emergency exit right at the back there where the green light is. There's an exit sign. So we can use that door as an exit, or we can use the same entrance where we came in from and go back out. The meeting point would be outside under the carport on the northern side of the compound. Coffee and tea stations will be available outside the room at 10:30 a.m. and 3:30 p.m. There's also water available in this room. Lunch will be served at 1:30 p.m. in the executive lounge, which is on the upper floor at the back. And I was told that an official group photo will be taken in the foyer right after the close of the opening ceremony. Thank you very much. Enjoy your meeting.
Thank you very much, Mr. Cole, for that very important information. We are now going to move into our welcome remarks, and I'm really pleased to welcome Ms. Elizabeth Solomon. She's Assistant Secretary General at the CARICOM Secretariat to start off the batting on the opening remark. You can give her a round of applause as she comes.
Thank you. That gave some energy. Good morning, everyone. It is really wonderful to stand right here and see this room full of really important stakeholders to this process. It's really at CARICOM we're very proud of our building and of our the space that we create for this kind of dialogue. So this is really wonderful. Anyway, I should get down to the proper protocols. Honorable Dr. Frank Anthony, Minister of Health of Guyana, Dr. Armstrong Alexis, my colleague and Deputy Secretary General of CARICOM, Her Excellency, Ambassador Jane Miller, British High Commissioner to Guyana, and Ambassador to CARICOM. Welcome. Dr. Juan Manuel Sotelo, now my friend, Interim Director of the Pan American Health Organization's Caribbean Subregional Program and Coordination Office. Ms. Piedad Puerta Ameros, did I get it right? Okay, it's okay. Clearly I didn't. Head of the Country and Subregional Coordination Office of the PASB. Mr. Daniel Albrecht, PAHO WHO Representative ad interim for Guyana. PAHO and WHO Directors and PAHO and WHO Representatives. Dr. Lisa Indar, ad interim Executive Director of our very own organization, CAFA. Miss Elizabeth Riley, Executive Director of SIDIMA. I'm not sure, is Elizabeth here? Mr. Adam Loye, Counselor, Development, Canadian High Commissioner. Mr. Aaron Spencer, Senior Development Advisor of USAID. Miss Micah Arts, UNICEF Regional Regional Office for Latin America and the Caribbean, representatives of member states and regional institutions, other international development partners, CARICOM Secretariat colleagues, members of the press, also my friends, and social media participants. Again, good morning. On behalf of the Secretary General of the Caribbean Community, I am really pleased to warmly welcome all the participants to the CARICOM Secretariat and to Georgetown. Minister, I take the liberty of welcoming everybody to Georgetown also. We are really pleased to be host to the convening of this multisectoral and stakeholder consultation towards the development of the new PAHO Subregional Cooperation Strategy. The Pan American Health Organization has consistently been a development partner in our collective efforts across member states, and this collaboration has proven essential in addressing the full gamut of health challenges that the region experiences. It was for this reason that the 47th Council of Human and Social Development meeting on health, which was convened in Washington, D.C. in September of this year, expressed its commitment to the development of a new PAHO sub-regional cooperation strategy for the Caribbean. This strategy that we are discussing today is expected to be aligned with the priorities identified by the Caribbean community. CARICOM's Caribbean Cooperation in Health, known as the CCH framework, is the regional architecture for improving health outcomes and strengthening health systems across CARICOM member states. The CCH outlines our strategic health priorities and focuses on collaborative efforts to address common health challenges, to promote multisectoral action, and to enhance the provisions of regional public goods. The CCH is aligned with global health agendas and emphasizes the importance of partnerships among health stakeholders, which is why we are all here today. Since its inception, the CCH has focused on resource optimization, on technical cooperation, on human development, and on environmental health. Most recently, the CCH has intensified its efforts on alignment with global health agendas in the areas of regional public goods, non-communicable diseases, health security, legislative frameworks, health system improvements, and on collaboration and partnerships. And of course, the impact of climate change. Implementation of the CCH framework has helped the region achieve significant milestones, like eradicating measles in 1991 and establishing the Caribbean Public Health Agency, and PANCAP, the Pan American Partnership for HIV/AIDS. The PAHO sub-regional strategies have been crafted to delineate how PAHO WHO will provide technical cooperation that is both responsive to and supportive of the Caribbean sub-region in navigating various health challenges. It is in this context that CARICOM anticipates the value that this new iteration of the PAHO sub-regional cooperation strategy will add to the pertinent and impactful public health initiatives to advance the well-being of the region. This consultation builds on the work done in earlier consultative processes to review and refine the strategic priorities and deliverables that will be included in the PAHO sub-regional cooperation strategy. I urge all participants to engage fully and in a forthright manner, to share insights and give feedback to ensure that the unique health challenges and the priorities of CARICOM member states are fully reflected. The Secretariat is pleased to support and to participate in this consultation, and I extend best wishes for fruitful consultations over the next 2 days, and expect that they will result in a collaboration that achieves our shared vision of improved health and well-being for all the Caribbean community. Together, we continue to build on our successes and to create a healthier, more resilient region. Thank you, and best of luck.
Thank you very much, ASG Solomon, for those words. It's always nice to be considered essential. So I know the PAHO hearts were gladdened with that word. And as you said, yes, these are some of the things we've been talking about, the need for collaboration and partnerships and alignment with the regional strategies that are already in place, and of course, the needs of our member states. So thank you very much. I'm now going to call on Ms. Piedad Huerta. She is head of the Country and Subregional Coordination Department of the Pan American Health Organization. They like when you clap.
Thank you. Good morning. Good morning, all. I'm so happy to be here today. I have been for the past 2 weeks traveling in different countries and working precisely in updating our subregional cooperation strategies in South America. Before we were in Central America, now we're here with you. So I would like to honor and greet all of you on behalf of Dr. Jarbas Barbosa da Silva, our director, who has committed us to do this job, to do this revision of our strategies, of our strategic lines of action with the Caribbean, and to bring them to a current status. So, Honorable Dr. Frank Anthony, our good friend, Minister of Guyana, Dr. Armstrong Alexis, Deputy Secretary General of CARICOM, Her Excellency Ambassador Jane Miller, British High Commissioner to Guyana, Ambassador to CARICOM, Ms. Elizabeth Salomon, Assistant Secretary General Foreign and Community Relations, Dr. Juan Manuel Sotelo, Interim Director of the Subregional Program of PAHO, Mr. Daniel Albrecht, PAHO and WHO representative ad interim in Guyana, Dr. Lisa Inder, Interim Executive Director in CARFA, and all other members and counterparts here united with us to do this work. Also, of course, our PAHO WHO directors that have traveled to this beautiful country to work with us on this. Also, we ask our Caribbean country offices representatives to come and work with us, hand in hand with us, in order to be aligned, in order to be sure that we're not duplicating efforts to work in the Caribbean. Same, and even I will say very important for us, our PAHO country office staff and our subregional program team. Thank you for being here. It is an honor and a pleasure to be here in Guyana, and especially in CARICOM, representing Dr. Jarbas Barbosa da Silva, our director, on behalf of the Pan American Health Organization, alongside my esteemed colleagues, as we take part in this important process of developing the subregional cooperation strategy with CARICOM. The Pan American Health Organization, as you know, is the world's oldest international public health agency that was established in 1902 with a vital mission to lead collaboration efforts among member states and partners to advance equity in health, combat diseases, and improve the quality and longevity of life of the people of the Americas. Today, we're especially grateful and happy because we have another celebration. We have the celebration of the 100 years, is today, exactly today, the 100 years of the Pan American Sanitary Code. A day as today, but 100 years ago, in another Caribbean land, La Habana, Cuba, was established the Pan American Sanitary Code. And I invite you to visit the code. It's in our webpage. It's more than ever current, even though it was established 100 years ago. I am proud to say that PAHO WHO has the largest and strongest international health presence in the Caribbean, underscoring our dedication to this vibrant region. The Caribbean, with its rich cultures, resilience, and promising potential, faces unique health challenges, from managing the rising burden of non-communicable diseases and combating infectious diseases outbreaks, to addressing the health impacts of climate change. Our cooperation is guided by shared goals and the understanding that health is a foundation for sustainable development, economic growth, and social well-being. To this end, the Caribbean Subregional Program was created in 1978 to deepen PAHO's collaboration with CARICOM and its institutions, CARFA especially, ensuring as well that global and regional health mandates are reflected in the subregion's priorities. The Caribbean Subregional Program has the following functions so far, even though we do much more: to engage with subregional integration mechanisms and partners to align agendas, policies, and frameworks, to lead the adoption of regional and global health strategies within CARICOM and the Caribbean, and to contribute to policy making with evidence-based information and tailored initiatives for the Caribbean context. This collaboration enables PAHO WHO to better align with country and subregional needs, fulfilling our commitment to addressing health challenges more efficiently, more effectively. This is the driving force behind the subregional cooperation strategy and also of our country cooperation strategies, which guides our work at both the national and subregional level. PAHO's strategy embodies PAHO's principles of equity and solidarity, reinforcing our role in supporting each nation's health priorities, but also finding our common goods for the subregional population by centering our efforts on national health development. The subregional cooperation strategy for the Caribbean will define the region's shared priorities, balancing the vision of PAHO WHO with the Caribbean common goals. This strategy will define PAHO WHO's work to support the common public health goods in the Caribbean, guiding the planning and allocation of resources and mobilizing support for the common priorities. It also enhances our ability to coordinate partnerships to tackle public health challenges with CARICOM and other health stakeholders through collaborative intersectoral initiatives. Developing this strategy together with all of you, our dear partners and collaborators, is an opportunity to reinforce our commitments and strengthen our partnerships for and to be more impactful in the work we do in other countries and subregions in the Americas. It allowed us to assess PAHO WHO's internal capabilities, technical, managerial, and administrative, to ensure we can meet the strategic priorities identified as deliver impactful health initiatives across the region. By aligning our technical cooperation with shared common public health goods, PAHO WHO can support the Caribbean in addressing its most pressing health issues. I would like to express my appreciation to the working group that has diligently for today's session over the past 2 months. Your commitment brings us closer to a strategy that is aligned with the Caribbean's health needs and aspirations. Today marks a crucial step in this collaboration journey. Your insights and feedback are instrumental, and we are here to listen. This is a participatory consultation, an opportunity for you to share your perspectives and help shape PAHO's WHO's agenda for health and well-being in the Caribbean in the years to come. That's why we have the directors, the technical directors here with us. That's why we have the different PAHO WHO representatives of all and each of our Caribbean country offices here with you. That's why we are here with you, to listen to you and to align. Together, let us build a strategy that not only addresses the common health challenges of the Caribbean, but also creates a pathway for sustainable health and equity for all. Thank you for being here and for your contributions to this important process. Thank you.
Thank you so much, Piedad, for outlining to us why we're all here. I think you have a bigger picture now as to why you see all of these partners in the room. And as she said, we do have shared goals and we are working towards a common good. So thank you very much for pointing. So just outlining to us why we're all here and why we're going to be working together towards these shared goals. So thank you very much, Piedad. We now move to my boss, Dr. Juan Manuel Sotelo. He is an interim Subregional Program Director for the office based in Boston.
Honorable Frank Anthony, Minister of Health, Guyana, Dr. Armstrong Alexis, Deputy Secretary General of CARICOM, Elizabeth Solomon, Assistant Secretary General of CARICOM, Mrs. Piedad Huerta, Head of Countries and Subregional Coordination in PAHO WHO, Excellencies, British High Commissioner to Guyana and CARICOM. Also, the representative from the Canadian High Commissioner. I greet also my colleague from USAID and my esteemed colleague from UNICEF that are accompanying us this morning. I greet all our colleagues from PAHO, especially our PAHO WHO representative in Guyana, David Albrecht, or Daniel, is with D. Okay, Lisa Inda, my colleague from CARFA, she heads the Caribbean Public Health Agency, and we were very close with Lisa and her team. I greet also all the stakeholders and partners that are around this table and also connected virtually, that we work hand to hand in putting together a good PAHO WHO technical cooperation for the Caribbean. I greet also my colleagues from PAHO, the esteemed representatives of the Caribbean. There are 8 of them, but today we have 7. Haiti is not accompanying us in this session, but has been with us through all the process before this session. For obvious reason, you know he's not here with us. And also, the dear director departments, we have 4 of them in this session, which is great. Thank you for accompanying us and being in this 2-day session for this exercise. Friends present, virtually also connected, and members of the press and media. On behalf of the PAHO WHO Subregional Program for the Caribbean, I welcome all of you to this stakeholders consultation to develop a subregional cooperation strategy for the Caribbean. Thank you all for your attendance and participation. My deepest appreciation to the CARICOM Secretariat for hosting us today and tomorrow in these excellent facilities. Please, Elizabeth, convey to Ms. Drayton how proud are we. You have honored your commitment, the invitation, Alison, and to me to have this consultation here in your premises. And Minister Anthony, we are very honored to have your presence here with us, and I must say that I feel in Guyana very much at home. Our task is to work together in building up a new Caribbean cooperation strategy for PAHO WHO's work in this subregion, which is an instrument that will frame our PAHO WHO technical cooperation for the next 5 years. This subregional cooperation strategy is a medium-term planning tool that once completed and approved will guide our activities, outcomes, and outputs, our budget, and our efforts to work together with CARICOM and its entities and other partners for the health and well-being of the people of the Caribbean. We will inform you during these days about the process that we have followed, but in a nutshell, we started with the political will. And this is something that the PAHOS director wants us to have. Okay, he has these cooperation strategies in most of the countries of the Americas. We have heard Piedad this morning about the efforts in Central America and South America. We have to complete ours because the previous subregional cooperation strategy expired in 2019. And then we have the pandemic that changed our lives, of course. So we are now ready to take a fresh look what we are doing here in this part of the world and build up something that is meaningful. In this political will, I talked to Minister Anthony, who was very much an instrument, and he presented this idea to have the strategy at the 47 COSOT meeting. Thank you, Minister Frank Anthony, for helping us on this. And COSOT followed his presentation, and they endorse and support the idea to have a strong and renewed subregional cooperation strategy. The following step was procedural matters. We adopted WHO guidelines because WHO provides us the norms to build up these strategies for the whole world. But the whole world do not have subregional levels, and the whole world do not have a Caribbean like this one, you know, with unique relationships, unique governance, unique entities, and so on. So we have to adapt these WHO guides for the Caribbean. So we did that. We also started the process of data collection and situation analysis. And we established a working group that made reference to this working group, in which we incorporate CARFA, we incorporate CARICOM, our colleagues from the representations. The representatives themselves were participating in this process, as well as the subregional advisors we have in Barbados and in other countries. No? And we start to working and getting together about what type of approach to handle, what type of instruments to develop. We developed a survey also, and we asked many stakeholders about their opinion, what their experience working with PAHO in the Caribbean was, where were our successes, where were our failures, what can we do better, okay? So we did all that. And then we had a technical consultation that was held in Porto, Spain, this week, on Monday. That was very helpful, and we come up with some priorities that were selected after a process of 10 discussions, no? Discussions that followed yesterday also here in Guyana, and you are going to see the status of those priorities and deliverables that we have reached so far. My expectation and the expectation of the organization is that with your inputs, this will get this richer in a more strategic way, not only with the technical inputs that we have obtained so far, but with your view, your knowledge of the Caribbean, your knowledge institution, we will build up something that will help us to take this to another level. Okay? Then this stakeholder meeting will review the draft and give us some suggestions and your opinion. We count on those. Again, the COVID pandemic that changed our lives has also paralyzed many things in health. Nevertheless, we can show good subregional products out so far, and we are willing to provide you with more subregional products. But we will listen to you, and we will get it richer the way we continue working together. The subregional cooperation strategy will be aligned with the many other frameworks of PAHO and from WHO, as well as the frameworks that we have in the Caribbean. This is very important. So alignment is the big word here we have to work around, as well as equity, which is central to the PAHO's work everywhere. You will see equity permeating all our activities always. And we are committed to support member states through the attainment of the Sustainable Development Goals. For us, that is very important. I thank you, and let's have an excellent consultation.
Thank you very much, Dr. Sotelo. And you segued really nicely for me because, as we know, we always need that political will, and we certainly have it in Minister from Guyana, the Honorable Frank Anthony, who broached this with all of his ministers and helped us to come together and here in his country today. So please welcome to bring the feature remarks, Honorable Dr. Frank Anthony, Minister of Health, Guyana.
Assistant Secretary General Elizabeth Sullivan, Dr. Pidad, Dr. Sotelo, PWRs from all the CARICOM countries that are here, with the exception of Haiti, all the distinguished ladies and gentlemen, of course, Jane Miller, British High Commissioner to Guyana, Adam from the Canadian Embassy, and all the excellent persons who are here with us this morning. I feel especially honored to be talking to this distinguished group about developing this comprehensive and resilient CARICOM subregional strategy. And I think it is very important that we have the collaboration of both CARICOM and PAHO in the construction of this strategy. Health challenges in the Caribbean are very complex, and they are closely linked to the social, economic, and environmental factors. And as we work to address the ongoing issues such as eliminating or controlling infectious diseases, looking at non-communicable diseases, the possibility of outbreaks of infectious diseases, and we have seen some of those over the last couple of years in the region of the Americas. We also want to make sure that we can create access to health care for all our citizens in the Caribbean. It has become clear to, I guess, all of us in this room that no single country or no single organization would be able to solve these problems alone. And that is why collaboration between PAHO, between CARICOM, and all the other regional entities that are here are not just strategic, but it is absolutely essential for us to collaborate. The collaboration between PAHO and CARICOM represents a union of expertise, resources, and a shared commitment. PAHO, with its extensive technical knowledge, global health connections, and experience in delivering regional health initiatives, supports CARICOM's vision of a healthy and resilient Caribbean. And in working together, PAHO and CARICOM can design health strategies deeply rooted in the Caribbean's context, strategies that can consider our unique cultural and socioeconomic and environmental realities. Some might say why we are doing this now, but as Dr. Sotelo pointed out, we have had an old strategy, and that was up to 2019. And because of the pandemic, we hadn't been able to work on a new strategy. But I think it's timely that we're here now. And I really like that we were able to get consensus at the COSAD in September. And within a very short period of time, we are here working on the development of this strategy. This represents the seriousness with which both PAHO, CARICOM, and all the other entities have placed on developing this strategy. What are some of the things that we need to respond to? First of all, in our region, we know that there's a rising cases of non-communicable diseases. The Caribbean has some of the highest rates of NCDs globally, including hypertension, diabetes, and heart disease. We also have seen, as we start improving diagnosis, that we also have an increase in various types of cancers. And therefore, it's imperative that we work on designing programs across the region to address some of these challenges. And I think a coordinated strategy using some of the experiences of PAHO, for example, would help us to roll out programs that have been effective. And why do I say that? So let's take hypertension, for example. PAHO, WHO has a very comprehensive program that is called HEARTS that deals with managing or getting people to better manage hypertension, which can be a risk factor for many other diseases. Here in Guyana, we have started to implement HEARTS, and we have already seen the benefits of having such a program. So it's not only preventative, it also encompasses a part in terms of treating people and managing their complications or delaying the onset of those complications. And that's why I strongly believe that working on a strategy that addresses a lot of these chronic non-communicable diseases would be important for our region. We also know that one of the pillars that PAHO has been advocating is to eliminate or control many of the infectious diseases. And when we look across the Caribbean, we can identify various types of diseases that need to be controlled, or in some instances, we can work on their elimination. Here in Guyana, we have just recently concluded discussions on malaria. This has been a problem that we have had for many, many decades. But our approach to malaria in Guyana has always been one where we were looking at controlling malaria, not eliminating malaria. But in the latest strategy that we have developed, we are looking now at the elimination of malaria from Guyana. And with new techniques that are now available, we are confident that this is something that we'll be able to do. We also have been working over the last couple of years on eliminating lymphatic filaria from Guyana. And we have already accomplished in 8 of our 10 regions, we have accomplished that elimination. And we have 2 regions that remain. And earlier this year, we've had mass drug administration to the population in these regions. And we feel very confident that when the assessments are done next year and the following year and the following year after that, that we will see positive results. So we are working on eliminating some of these diseases. Some of them are very old diseases that we've had in this country for more than a century. But the prospects now are very good. And I think when we look across the Caribbean, there are infectious diseases that we can work on to make sure that we eliminate some of them and we control some of them. And there are new challenges that are emerging. We have seen viral diseases that were previously dormant. We are now seeing them emerging. Oropouche, for example, we're seeing cases of that. And there are many other that are becoming more prevalent in our region. So it's imperative that those that we can eliminate, we take them off the table and we work on the new ones that are emerging so that we'll have more space, more resources to dedicate to the newer ones that are coming. There are also some very positive things that we can do across the region. Hepatitis C, for example, is one of those diseases maybe that we don't pay a lot of attention to. But because of an initiative of PAHO, where through the revolving fund, they have been able to access medication at a very affordable cost. So think about this. Just maybe 2 years ago, the cost to treat a person with hepatitis C might have been about 20,000 US dollars. That came down to 1,500 US dollars. And with the assistance of PAHO through their revolving fund, it's now less than 100. There's no excuse why patients with Hep C in the region should go untreated. And we have been able to benefit from this revolving fund. We've started a program 2 years ago. We have already demonstrated results by curing at least 42 people because they came into our program, we've treated them, and now we're not detecting any Hep C. So I think this is not a positive thing that we can do. Of course, there are other established programs that we can work on, controlling HIV, and we need to do that in the light of dwindling funding for the Caribbean. So many of our Caribbean countries are not eligible for Global Fund resources. So these countries have to deal with HIV all on their own and find the resources to deal with it all on their own. So this is an area that we have to work on because it is important for our region. When you look at the global statistics, this is one of the regions that are most affected, but one of the regions that benefit less from global resources to be able to fund some of these programs. So I think we have our work cut out in this area. As if we need to be reminded, but I'll just say it, the pandemic has shown that we've had several weaknesses in our system. When the pandemic hit, many of our countries were so totally unprepared. We were not able to do diagnostics. We didn't have the capability of doing PCRs because we did not have the equipment available in our countries. Maybe we have been able to correct some of that now, but we still need to be vigilant and we need to build out laboratory systems so that we can do the diagnostics for whichever viral infection and whichever infection would emerge in the region. So that's something that we have to pay a lot of attention to. We also have to build out a robust surveillance system. And we have to adopt a One Health approach because we know that future threats or emerging diseases, we'll see a jump from the zoonotic diseases across to human population. And this can be challenging for us if we don't have a very comprehensive surveillance system. So it's of utmost importance that we pay attention to developing One Health in the region. We have been able to make some progress, I would say a little bit of progress, and that is through the pandemic fund, CARFA would have benefited from some resources. They might not be enough, but certainly we have something to start with. And they are working, I think, in 15 countries, or 26 countries. But the sums of money that they have to start strengthening the pandemic preparedness in the region, at least we have some start there. More recently, we have seen Suriname also benefited from the pandemic fund. We have a project also in Trinidad, and I think there was one in the OECS that also received funding. And here in Guyana, we also benefited from those funds. So you have countries in the region or collections of countries in the region that would have benefited from these funds. And over the next 3 to 4 years, what we need to do is to make sure that we strengthen our systems to address surveillance and all the other things that can make us more resilient in preparing for pandemics. But there was another challenge that we observed during that period. As small countries, we did not have access to vaccines. And it took us a while before we could actually get access to vaccines. And I recall trying to talk to some of the companies that were at the forefront of producing vaccines. But because of our requirements, we had small requirements, and one would have thought that those would have been easily fulfilled. But we were really at the back of the line. And even if you had money to pay for it, it was a struggle trying to get those vaccines. Thankfully, we were able, after some time, through COVAX and through bilateral arrangements, to be able to access vaccines and other things that were needed in the pandemic. We can't make that mistake again. It is not if we are going to have another pandemic. It is probably when we are going to have another pandemic. And whenever that comes, we have to be prepared. So one of the things that would be essential in this region is to see how we can develop capacity or what linkages we can have with other countries in the region to ensure that we'll have good supplies of medicines, things that would be necessary, the medical supplies that would be necessary in fighting future pandemics, including diagnostics, because these things are important. And therefore, we should learn the lessons from the last one. We are just coming out of it, and be able to have this capacity. One of the things, too, that we were lacking, we did not have in the region, was the ability to do sequencing. And this is another area that during this period, as we move forward, that we be able to develop the capacity to sequence different types of viruses so that we understand what is circulating. And what we are asking for now is not something that wouldn't benefit the rest of the world, because whatever we are doing, we are sharing the information so other countries around us, even farther away, can understand what is going on in this part of the world. And by knowing and by taking measures, we'll all be protected. But if we don't know, then all of us would be vulnerable. And I think this is absolutely essential for us to do. Another area speaks to equity. And in our countries, there are areas that don't have the necessary access to healthcare or limited access to healthcare. And if we are going to honor universal healthcare coverage, then this is one of the things that we have to seriously address. Luckily, I think that, again, one of the programs that I've seen at the last Directing Council that is being offered by PAHO is the use of telehealth or telemedicine. This can help us to bridge the gap in the interim while we work on extending or getting people out to some of these underserved regions. But in the interim, this is a measure that can be used for us to bridge those gaps. So helping to improve accessibility, I think, and equity, I think these models, we need to adopt them. In Guyana, we have already embraced telemedicine, and we have right now at least 53 sites that we are operating. By the end of the year, we are hoping to have 80 sites. And by next year, we are hoping to scale that up to almost 300 sites across the country. And we have seen the benefits of this, because you can use very limited amounts of people, but you can improve the quality of care that you're delivering in very remote communities. Environmental health is a big challenge, and I think for most of our countries, this has not been an area where we have paid a lot of attention to. But we would have seen that over the last 2 or 3 COPs now, that a lot of attention is being paid to environmental health. And in the region, we have lots of vulnerabilities, from hurricanes to rising sea level. These are challenges that we have. And we need to be better prepared to respond to some of these challenges. So while I know that we have agencies that can respond immediately, I think the health challenges and building back systems or even building the hospitals to withstand some of these hurricanes and things like that, flooding and so forth, are very important. I know the UK had a program in the region looking at smart hospitals that make them very resilient. But it's not just a few facilities. We have to do this across the board so that all our facilities are more resilient. So in the times of crisis, that we are able to withstand this because we have institutions that can deliver the kind of care. So this is another area that I think, as we have the consultations, that we should look at. Mental health is something that is there. We don't talk about it a lot. And some of you might be surprised to know that we still have legislation on the books in the region that criminalizes attempted suicide. So we need to change that. And apart from changing legislation, it is to adopt principles that are more aligned with human rights of our patients. How do you get patients into the hospital? How long should they stay? We shouldn't be keeping people for decades in a hospital. We have to ensure that when they have an acute episode, they come in, they get their treatment, but then they go back home. We have to make these services available at the primary health care level and so forth. So it's a paradigm shift from what we have been doing, and it would take time to undo what we know and what we have been doing. And with this comes a lot of work dealing with stigma and discrimination, because a lot of people might have mental health issues, but they are afraid to come forth because of how they will be labeled. We have to develop a society that becomes more accepting, where people issues, they don't feel afraid of coming forward to get their issues addressed. So we can move these things that are currently hidden from view to one where people can come and access care more easily, because this in itself is a barrier to care. If we don't know where our patients are and how to help them, then we'll have difficulty managing these patients. So mental health is a big area, and there are lots of programs from preventative right up to making sure that access to psychotic medications are available, because in some cases it is not available across the system. And again, these are programs, and I don't think these are big asks, because I know that at the level of PAHO that they have been working on these things consistently. But what I think we need as we do this next program is to have measurable things, so that in 3 years or 5 years from now, when we meet, that we can actually see that we are making progress. And I'll go a little bit further, because every year we do the COSAD on health. So that COSAD should be used as a monitoring tool, where every year there's a report that can be delivered at the COSAD to show whether we are making progress, and if we're not, what can we do to make sure that we're moving these things forward. To make sure that this partnership between CARICOM and PAHO is sustainable, I think we could look at a set of areas that would be very, very important. In the region, we need to have data-driven decision making. And I don't think we collect enough information to have this appropriately done. And I know sometimes for the countries, because we have different reporting mechanisms, that this can lead to us submitting to different entities 3-4 different types of information. We need to coordinate that so that you don't put a burden on the countries that are reporting, but that we collect the information that are necessary and it's shared with everyone. but we need to collect information across the board on the things that we want to track. And this is an area I think we should place some emphasis on, because it's important if we are truly going to move this system forward. Another area that we have to really do something is the area of retaining our workforce. So this region has become a region where a lot of our trained workforce are now being incentivized to move away from the region. And that is now challenging the gains that we would have made in our health system. Because if we don't have the nurses in our hospital, then the care for those patients are going to decline. And in the region, as far as I know, we are not training fast enough to replace those who have gone elsewhere. So this is a crisis. And this is one of the things that we need to frontally address. So any plan that we're doing would need to look at how we deal with human resources. What can we do? And apart from trying to talk to the countries and so forth who are taking our human resources, what can we do internally? What can we do in the region to make sure that we are training and retaining and so forth? But I've seen that we have had, over the years, we come up with some really good plans. They don't work because we don't implement them. So if we are going to move away from that, we got to come up with practical things and do things that can make a difference. So it's not writing a nice plan to put on a shelf and say that we've done something about this. We have to do things that can make a difference, because our health systems are going to suffer, or people are going to suffer, because they're going to get less qualitative care. So we need to change that, and I think we need to change that very quickly. Between PAHO and CARICOM, been very good at supporting some capacity building. We need to map that out as well and make sure that we are coordinated, so that we don't have one type of training on, let's say, epidemiology today, and we're doing a similar training in the same country, but maybe we call it differently. We need to coordinate. And so we can spread those resources so that a lot more people can be trained, because these things are absolutely essential. Community engagement and awareness is also very important, because all these nice plans that we have, without engaging the community and getting them to change some of their health habits, they're not going to work. We can put the systems in place, but we also have to change people's behavior. And we know a lot of the risk factors to chronic non-communicable diseases are lifestyle factors. But if we can't get our societies to change their behavior, then we are going to continue to have these problems. So there must be a concerted effort where we are able to do this. And that we have to look at nutrition, we have to look at what we're eating. We have a lot of ultra-processed food that are in the region. We have moved away from the nice vegetables that we can get from the market, and we have now a different type of taste, because we prefer the things in the box that we get in the supermarkets. And we know the impact that this is having on our health. So this is another area that I think in any plan we need to focus on and come up with some measurable results. Innovation is another area, because we would be able to deliver more health if we embrace innovations that are happening in health. So telemedicine is one good example. And while we are using this internally in the country, I think there's need for regional legislation as it pertains to telemedicine, because the systems that we have can easily go across borders. But if you're going to treat somebody across the border, then what is the mechanism for that person to be registered within that jurisdiction? And this is something as a region we need to address, because we can't do it as individual country. We need to do it regionally. And this is something maybe that CARICOM can take a lead on. And we've had instances of how we can do these things. We have done this with cricket. We have done this with a whole host of other things where we have common legislation that governs the CARICOM space. There's other things that we also have to look at, and that is the use of AI in health and how we can harness it for good. Right now, AIs can be very helpful in interpretation of images and like X-rays, CT scans, and so forth. They're pretty good at diagnosing using AI. And we need to harness this because we don't have enough resources in the region to be able to do all the interpretation that we would like to do in the region. So this is something I think we need to work on. So as we meet today, I think the whole process of having the working group, having the technical people meet, getting all the decision makers in one place and having these discussions, I think it's very, very important. And I hope that we spend the time to craft something that is going to be useful for the region, very pragmatic, so that we can measure it, and over the next couple of years, we use this as the benchmark to measure progress in the region. And all of us in the room, whether it's countries, whether it's CARICOM, UNICEF, all the aid agencies that are here, and of course PAHO, we can look at this and say, yes, this is a tool that is helping us to measure that progress. And I think if we are able to achieve that, then this would be an extremely useful exercise and help us to, in future, keep doing them so that we can see a difference in our region. As I said, there are many challenges, but with our collective effort, I'm very confident that we'll be able to make a difference. And while I didn't touch on that, we also have to look at where we're getting some of the resources to make some of this happen. But I'm sure our friends at PAHO would help us with it. Thank you.
Wow, that bouncer at the end was serious. You know, people usually remember the last thing they hear, right? So I've written 3/4 of my page of notes from Minister Anthony's speech, and I saw Piedad and Suad and everybody writing as well, and Rufus, who I will point out to you soon. So really, really, really interesting points, some really good recommendations. We hear you, and I love the challenge to not just write a nice, beautiful strategy with a glossy cover, but to actually do it. That's the challenge, to actually do it. So thank you very much, Minister. If no one else did, I've got lots and lots of notes, so they will be taken into consideration. So at this time, I'm going to thank everyone who spoke in the opening. We've made a slight change to the proceedings. We're going to move the presentation of the development and the situation analysis to right after we take a short break. We're going to take our group photo now that you're looking fresh and lovely. So we're going to do that group photo now, take a short coffee break, and then we will come back and I will hand over to Rufus. Rufus, wave at us.